In this video, we are going to discuss the differential diagnosis for hyperphosphatemia in small animal medicine. The differential diagnoses are going to be listed in order of likelihood, for patients presented with hyperphosphatemia. Hyperphosphatemia is a condition in which there is an elevated level of phosphate in the blood. The first differential diagnosis for this condition is pseudohyperphosphatemia. Pseudo means false, so pseudohyperphosphatemia is a false elevation of phosphate levels in the blood. Pseudohyperphosphatemia can be caused by in vitro hemolysis of the blood sample or by hyperglobulinemia due to monoclonal gammopathy. The second differential diagnosis is a physiologic response. Mild increases in phosphate levels can be normal in young animals. Hyperphosphatemia can also be the result of a mild postprandial effect. Our third differential diagnosis for hyperphosphatemia is decreased renal excretion. Conditions that result in a decreased renal excretion of phosphate are the following: decreased glomerular filtration rate prerenal, renal or postrenal, uroabdomen, primary hypoparathyroidism, hyperthyroidism, and acromegaly. The fourth differential diagnosis is an increase in gastrointestinal absorption. Increases in the absorption of phosphate can occur in cases of hypervitaminosis D due to cholecalciferol or calcipotriene toxicity, granulomatous disease, phosphate enemas, phosphate-containing urine acidifiers, and in cases of a devitalized intestine. The fifth differential diagnosis for hyperphosphatemia is the effect of a transcellular shift from the intracellular to extracellular fluid. A transcellular shift can occur in cases of metabolic acidosis, myopathies, arterial thromboembolism, and acute tumor lysis syndrome. Our last differential diagnosis for hyperphosphatemia in small animal medicine is xylitol toxicosis, a condition that produces liver failure. Although patients may initially be hypophosphatemic, due to increased insulin within the first 12 hours after the ingestion of xylitol, liver failure-associated hyperphosphatemia can occur due to an unknown mechanism and has been associated with a poor prognosis. Please remember that you can help us to train the veterinarians of the future by liking this video and subscribing to our channel. Thanks for watching our video.